There are several myths in relation to diabetes care that are truly worrying. I think one of them is that now that I'm on injections, my diabetes is much, much worse and I'm definitely going to die, definitely going to get a heart attack or go blind or have kidney disease. It doesn't mean that. It means that your diabetes control is such that you will benefit from having insulin, benefit from having that weekly injection maybe for weight loss and improving diabetes control. So really, you mustn't think of having extra medications nowadays as your diabetes is getting worse and the inevitable worsening is going to happen. We are in a game of preventing diabetes complications. So a lot of these drugs will now be used earlier on to prevent future harm. And all we want to do is get our patients to have a long, healthy lifespan without heart attacks, without strokes, without kidney disease, without amputation, without blindness. And the only way we can do that is giving you the best care possible, which will sometimes be injections, including insulin. In South Asian communities, there will always be the reluctance to go on to injections. People prefer tablets. But even some of the newer agents that we have, including the once weekly injection, now comes in a tablet form. But another problem in the South Asian community is not admitting to your friends and family that you actually have diabetes, so that you're taking a little bit extra of that sugary dessert, for example, because you're not telling your close family and friends that you actually have diabetes. I think we need to work as a family, as a group of friends, as a community, to make sure that anybody that does have diabetes, that the community supports them. And this may well be changes in diet, the way that people cook and serve out desserts and things like that. But maybe it's something that we want to do because we care for our acquaintances, friends, and family members. In terms of how diabetes is viewed, it was almost seen as a disease of failure, a failure to look after yourselves. But I think we have to remember that we live in a society that has promoted high carbohydrates, that's promoted an environment that is not conducive to exercise. So I think we do need to think about how we can best help ourselves. And one of the differences I think that we have is that we don't feel empowered to get rid of diabetes in our families. I think human beings always like to learn about something new. It's our curious nature. It's good that we learn. However, some of the sources are not based on science. For example, social media or even magazines or TV programs. They'll talk about cure-alls, but ultimately at the end of the day, it's a healthy diet, the physical activity, maintaining an optimal weight. So optimal weight does not always mean looking thin, but reducing the weight that you have towards that optimal weight for you, but also taking the right medications as well. So in terms of herbal remedies and diabetes, so many of the medications that we have actually come from plants. So metformin, which I'm sure most people with type 2 diabetes would have heard of, actually originally came from the biochemistry from a compound from a plant called the French lilac, Galegia officinalis. We also know that other drugs, for example, even the SGLT2 inhibitors, which are taking the world of diabetes by storm because they're reducing heart disease, heart failure, kidney disease in our patients. The original biochemistry came from studying apple bark, and the same compound is there in apple skin and the core of the apple as well. So a lot of these drugs do actually come from plants. But the problem with herbal remedies from India, Pakistan, or Bangladesh, or Sri Lanka, or Nepal, is that we simply do not know how much of the active ingredient is in there. You wouldn't take paracetamol if you weren't sure that a single tablet was 500 milligrams. You would not be happy if it was 100 milligrams or 1,000 milligrams. We know that when we get our drugs from European drugs or generics from abroad, places like India, places like Brazil, then we know that we're getting the right amount of the drug. So it's very important to have prescribed medication as far as possible. I think diabetes in itself should not have a negative influence on your life. You should think about all the amazing people out there who have won Olympic medals with diabetes, with type 2 diabetes. We've had fantastic cricketers who've had diabetes, footballers, all from the South Asian community. So there is very good evidence that if your diabetes is well looked after, it is a condition that you live with. It's not a condition that defines you. It should not be a condition that changes your aspirations in any shape or form. You can do whatever you like. However, please make sure that you pay attention to controlling that diabetes, to optimizing the blood pressure, the cholesterol, the diabetes control, such that you can have a life without complications for as long as possible.